I am Jody Smith. I'm the National Program Director for Mended Hearts and Mended Little Hearts. We also have the VP of Mended Little Hearts, Liz Blumenfeld, on the line. We're going to stay mostly in the background and allow our presenters to present. But I'm really excited. We have Julia Price, and she is a licensed psychologist in the Center for Pediatric Traumatic Stress in the National Child Traumatic Stress Network. And that is located at Nemours and Children's Hospital of Philadelphia, and is co-directed by Ann Kazak and Nancy Kassam Adams. And the goal of this center is to develop resources and trainings related to providing trauma-informed care in pediatric settings. Dr. Price is also a research scientist in the Nemours Centers for Healthcare Delivery Science and an assistant professor of pediatrics at the Sidney Kimmel Medical College at Thomas Jefferson University. Dr. Erica Sood is a pediatric psychologist in the Nemours Cardiac Center at Alfred I. DuPont Hospital for Children. Her research focuses on partnering with parent and clinical stakeholders to develop programs to better support families of children with congenital heart disease. She directs the Nemours Cardiac Learning and Early Development Program and trains psychology trainees in the specialty area of cardiac neurodevelopment. She's also co-chair of the Cardiac Neurodevelopmental Outcome Collaborative and the psychologist lead for the family CARES Learning Lab with the National Pediatric Cardiology Quality Improvement Collaborative. I should probably have gotten these terms pronounced correctly before the webinar, but there you have it, and they can correct anything that I was mistaken on. But we are absolutely delighted to have them here today, and I'm going to turn it over to Dr. Sood to start with.
Great, thank you, Jody. So I'm Erica Sood, pediatric psychologist in the Nemours Cardiac Center. I'm so excited to be presenting with Julia Price today on helping children with CHD and their families cope during the COVID-19 pandemic. So we're going to start with a brief overview of the impact of COVID-19 on families, as well as some general tips to help your family cope during the pandemic. And then Julia is going to be walking us through a toolkit for emotional coping for parents and caregivers that I think many of us will find very helpful. So as you know, COVID-19 has a huge impact on families. So many families are having to manage disruptions to their family routines, separation from friends and loved ones. Many parents are struggling with trying to balance work and family needs without a lot of outside help, which can result in the inevitable changes in parenting practices. Specifically for parents of children with congenital heart disease, it can be really hard to manage the changes that have occurred in how medical care is delivered, as well as potential delays in your child's medical care. So for example, delayed surgeries or procedures or appointments. While all families are hugely affected by COVID-19, we're also learning that some families tend to be even more impacted than others. So related to disparities in health and healthcare. So for example, racial and ethnic minorities, immigrants, non-English speaking families. And so there needs to be much greater effort at addressing these disparities in health and healthcare, both related to COVID-19 and other health outcomes. So as a cardiac psychologist, I often say that mental health and heart health go hand in hand. And I encourage all of you to really focus on mental health in yourselves, in your partner or your spouse, your child with CHD, as well as any of their siblings. So how might COVID-19 impact mental health? Well, in many ways. So we know that many people are feeling more anxious and worried these days, and that's normal. So you may find that your children are asking more what if questions, or you or your partner may be focusing on the worst case scenario. Somebody in your family may be having difficulties concentrating or sleeping. And you may also notice that someone's experienced one or more panic attacks. You may find that people in your family are exhibiting more depressed symptoms. So for example, exhibiting tearfulness, irritability. You may have a teenager that's less interested in hanging out with the family or connecting with their friends, as well as changes in sleep or appetite. So sleeping or eating more, or sleeping or eating less. Traumatic stress can occur when somebody has experienced a very scary or life-threatening event, so a trauma. And this is something that's talked about a lot, specifically for families of children with congenital heart disease, because we know that many of the experiences that parents and children have related to their child's CHD can be traumatic. And specifically for people who've experienced traumatic events in the past and have had traumatic stress symptoms, it's really important to notice whether this might be a time when some of those thoughts and feelings are coming up again. So there's a lot of focus on health, on safety, on germs. And some people have noticed that they're having more of these thoughts or images about prior scary events that are popping into their head. So what does traumatic stress look like? We often think about this in four kind of areas, and that's the diagnostic criteria for PTSD. So re-experiencing, so feeling like scary events are happening again, or having thoughts or images popping into your head, getting really upset when something reminds you of a past traumatic event, changes in thoughts or mood, so feeling more scared or angry or guilty or ashamed, having thoughts like, the whole world is a scary place, or things are never going to get better. Avoidance, so avoiding things that make you feel scared, avoiding things that remind you of the prior traumatic event. So for example, driving a different way so you don't have to drive by the hospital or a clinic that might remind you of it. And hyperarousal, so feeling very jumpy on edge, having a hard time concentrating or sleeping. So I'm going to go through some tips that may be helpful for coping with COVID-19 related stressors. But I just wanted to note that all families are different, and there's really no right or wrong way to cope with the pandemic. You know your family best, you know your children best. So take the tips that I said, think about which ones might work best for your family. We all know that there's a lot going on in the world right now, and it's really important to stay up to date and to know what's going on. At the same time, it's also important to think about how much time listening to or reading the news or social media is too much time, and where those limits need to be for yourself, for your children. It's important particularly to take a break from the news or social media in the hour before bed, particularly if you're somebody who has a hard time falling asleep or staying asleep. And then it's also important to consider what information your children need to know about COVID-19, as well as other current events. It's important that depending on your child's age, they do know something. We don't want to just kind of keep them in a bubble and completely protect them from everything going on. At the same time, you want those conversations with your children to be deliberate and developmentally appropriate. And so limiting adult conversations that really aren't intended for your children in the presence of your children whenever possible. And remaining calm and reassuring with your children, making it clear, what's your child's role in this? So for example, your child can make sure that he or she washes their hands and stays 6 feet away if they're old enough to understand that concept. But you also want to identify, what are the adult responsibilities and what are the things that you don't want your child to have to worry about, because those are the job of the grown-ups. And also following your child's lead and making yourself available for questions when they ask those questions whenever possible. Oftentimes when parents try to start conversations with their kids about important conversations, their kids, they're not that interested or they're in the middle of something else. But it's only when you're in the middle of something very important that all of a sudden they have 100 questions. And so as much as possible, trying to work around, when your child is sort of open to having these conversations and is asking questions and trying to follow their lead whenever possible. It's great to try to resume prior routines that you had, but in some cases you may need to develop new routines because things are so different right now that those old routines really don't apply. So think about developing new routines when needed for the morning, for meal times, for bedtime, especially if your children are not going to school right now and you may still be working remotely, or at least some days. Thinking about, what can your family do in the morning that still helps people kind of get up and going, whether it's get dressed, brush their teeth, maybe as the adults, even if you're working remotely, getting dressed and taking a shower. Your family probably had routines for meal times before. You may still be doing those routines, but if not, think about developing new routines around meal times, as well as bedtime. We know that kids tend to sleep best when they have consistent routines before bed. That sort of signals to their brain that it's time to go to sleep. Developing routines for the start and end of the workday and the start and end of the school day. And this is really important for people who are working and doing school remotely, because there's really no clear start and end time. And it can be hard to have that kind of mental separation like you would if you were commuting or picking the kids up from school or doing after school activities. And so thinking about what might be a good routine to signify to yourself or your kids, now is the time to do school, now is the time for work, and now is the time to kind of shut that off and focus on family. When you're thinking about routines, it's always important to include activities that help family members relax. It's always important to have it in our routine, although it can be hard, and it's particularly important in a time that is so high stress. That may be taking a family walk, that may be doing a 5-minute relaxation exercise on an app. For example, the Calm app can be really helpful for that. That may be going outside and running around the yard for a period of time after school hours. Setting limits on children's behavior. This can be really hard when you're dealing with a different routine. And especially when you can understand why your kids are feeling frustrated or stressed out or irritable. And I think what's really important to keep in mind is that all feelings are okay, but all behaviors are not okay. And so it's okay to feel frustrated, it's okay to feel angry, it's okay to feel sad, but we still have to behave in a certain way, and limits actually do help kids to feel more safe because it helps them to recognize that there's somebody in control. And that adult is going to respond in a predictable way. So thinking about, can you respond to your child's behavior in the same way that you would before? And if not, what are your new limits and how can you respond in a way that helps your child to know what to expect? And then considering what you can and can't control. There's a lot we can't control right now, but there are some things that we can. And they may seem minor, but these are things that can help us to cope because it's important to feel in control at times. And Julia's going to talk a little bit more about that later. So using technology to stay connected, I think we've probably all gotten pretty good at this. As adults and teenagers, we don't really need a whole lot of help typically to stay connected. We're all on a Zoom call right now, so everybody has access to Zoom on this webinar. But younger children, it can really be beneficial for them as well to stay connected to grandparents, friends, family members, and they probably need a little help from you to do that. Reconnecting with people that you care about. So at a time when, we're still encouraged to socially distance, it can be a time to say, well, distance doesn't really matter anymore in that it's not like I'm getting together with my next door neighbor. So who have I maybe lost touch with over the last few years as things got so busy that I'd like to reconnect with now that, we're connecting primarily through technology anyway. Engaging distance help. So, depending on where you live, you may have started to see grandparents, extended family, you may not have, but, people can still help through technology, through Zoom, through FaceTime, figure out how people can help from afar. Monitoring mental health. This is something that's important at all times, and particularly during times of stress. So just checking in periodically on the mental health of your family and yourself. Just kind of checking in. How are people doing? How are people feeling? It's okay to talk about our feelings, and it's okay to feel sad, and really communicate that we want to have an open dialogue about mental health in your family. Listening to and validating challenges and concerns. So I think as parents, it's very common, and I find myself doing it, where we want to just kind of jump in and solve the problem, or kind of explain to our kids why they don't need to feel sad or they don't need to feel anxious. And sometimes I think that can make kids feel invalidated, like nobody's really listening to them or really understanding them. And so I think as parents, we all need to kind of just take a deep breath and stop talking and just let our kids talk. And validate, that really stinks. It's really hard that you didn't get to do that end of the year activity that you wanted to do, or that you don't get to see this friend, or that you don't have to get to go to this party. And at the end of the conversation, certainly offering some alternative solutions, but not jumping in with that right away. Considering whether social or peer support may be helpful. So I think many people on this webinar have used peer support in the past, through Mended Little Hearts, for example. And this may be a time where peer support may be particularly important. And it may not be the same people that you went to when your child was having heart surgery or first diagnosed. It may be different people who can really relate to what you're going through right But thinking about, who are the people in your life that, or how can you connect with others who will understand the stressors that you have and that your family has right now. And then considering whether professional help may be helpful or important. I think some mental health practices are starting to see patients in person again, but many have converted to telehealth, or at least still offer that. And these are video sessions with a mental health professional. The benefit of telehealth, obviously, is that you don't have to leave your house. So issues with scheduling and transportation are less. In some cases, the rules around seeing somebody out of state, which, in the past, someone had to be licensed in the state where you were being seen, is no longer the case depending on the state. So that's something to look into. And if you feel like that would be helpful for your family, you can call, if you've ever had anyone in your family see a psychologist or a therapist in the past, call that practice and find out if they're doing telehealth, or call a local practice, or call your insurance company and get a list of mental health professionals who are covered by your insurance. Consider what's helped in the past. So, parents affected, families affected by congenital heart disease have been through very difficult times in the past. And certainly it's different than this pandemic, but those times can be filled with uncertainty, with disruption to family routines, with separation during hospitalizations. Certainly social distancing is something that this community is probably more familiar with than most, as well as the financial stress. And so thinking about, what has helped you in the past, and there's probably, that doesn't mean that the stress went away, and it doesn't mean that everything was better, but were there things that you did that you kind of worked into your routine that helped you cope, and are those things that you can work into your routine again? And then focusing on the silver lining. So for most families, they are able to identify some positive effects. So maybe spending more time together as a family, having more time with their kids to just kind of play and use their imagination. For folks that travel for work, less running around and less traveling and more time at home. And thinking about, are there other positive effects that your family has experienced? This is a time, if you haven't already, where it's really important to talk to your kids about helping others. Many people are struggling right now for a variety of reasons, and this is a time to think about how to really educate your kids about how they can contribute and how they can give back, and how they can help others and really develop that empathy. And then talking about what your family is thankful for. So whether that's something that you do every day or you do once a week, making that part of the family conversation. So there are some websites I just want to direct you to that have CHD specific resources for coping with COVID-19. So the Cardiac Neurodevelopmental Outcome Collaborative, CNOC, if you go on their website, which is cardiacneuro.org, there's a tab that says COVID-19 resources, and there is, we've developed 3 different handouts focused on helping adult patients, helping parents cope, as well as helping children, parents and caregivers helping children to cope with COVID-19 related stress. There's also one for healthcare workers as well. The Cardiac Networks United is, they have a very comprehensive page that has a lot of information. Some of it's for parents and families, some of it is for healthcare workers, but definitely worth checking out. And then National Pediatric Cardiology Quality Improvement Collaborative, CQIC, they've actually developed a document that has, and this was a couple months ago, I don't know if it's been updated, but describes many of the studies that have been done in children related to COVID-19, or in the papers, research papers, and explaining it for parents and community members. And these summaries were written by the research committee that includes parents and patients on it. And the goal is really for parents and patients to be able to easily understand what the research is telling us about how kids are affected. They also have a lot of other information on there as well. So I'm going to pass this over to Dr. Price, who is going to be he's going to be walking us through a toolkit for emotional coping for caregivers. And then at the end, we will take questions.
Thank you so much, Erica. Yeah, so let's see if we can, how seamlessly we can do this transition to my slides. So Erica, you might need to
stop sharing
first. Yeah.
Okay, just did.
Great. Thank you. Looks like this will work. Okay, great. So again, thanks, Erica, and thank you all for your time today. As Erica mentioned, I'm going to spend the last portion of this webinar walking you through a toolkit that our group developed to support emotional coping for stress and traumatic stress related to COVID-19 for caregivers. And just kind of as a heads up, some of the things we're going to do together, it might be useful to have paper and pencil nearby or pen to kind of jot some things down. So this is the name of the toolkit we're going to talk about, Toolkit for Emotional Coping for Caregivers. And this toolkit includes 3 tools that are based in research or evidence-based tools for coping and will help you all understand and then manage adversity. So we hope that the tools can be used again and again for new or recurring stressful situations. And all of these tools really try to take on an interpersonal, family-based approach, which is why we note here, and you'll notice me comment throughout, that we really encourage you, if possible, to go through these tools with your family, with close friends or your peer support group, and we find them to be most helpful in that situation, but they can also be used individually. So these tools are based on both cognitive behavioral therapy skills and family therapy skills. So again, this is a toolkit, so you can pull the tools out when you need them, and that might be when you're experiencing distress or traumatic stress symptoms that Erica described earlier. And these tools offer a process for you to hopefully move towards a more positive emotional place. And just like a hammer and a nail don't fix your fence for you, you'll have to actively use these tools to cope more effectively with an adversity. And again, you know, we're kind of highlighting over and over that it's most useful to do with your family, as we find that going through this kind of process with them can help bolster your relationships. So here are the 3 tools that we're going to walk through together. And we're going to start with the ABC model, again, saying right now you might be doing this individually. You might also be sitting with some family members listening to this webinar and could do it together. So as we kind of lead into this first tool, the ABC model, I think it can be helpful to try to kind of think for a minute about the current context. So how life has been for your family. So what's it been like for you to care for your child or children, if you have multiple children? What have been some highlights for your family as a whole? What have been some challenges that you faced individually, as a whole unit? And how have you made it through those challenging moments or scary moments? And who has been a part of your family's bright moments and moments of overcoming difficulty? What do those look like? So I'm trying to move slowly here so to give you some opportunity to think about this. And you might even jot some things down. And keeping all of kind of that in mind, let's talk now about how you are doing currently. And we're going to try to understand how your feelings and thoughts and your behaviors in this moment are contributing to your overall well-being, kind of where you are emotionally right now. So this is the ABC model that we're going to walk through step by step together. You can see on the side here that this is a point where you might pull out that paper and pencil or open up a blank Word document on your tablet or computer to try to fill this out with me as we go through it. So the A stands for adversity. And what I'd like you to do is try to think about an event that has been particularly upsetting to you recently. And ideally, you're thinking about a pretty specific event, not kind of the broad overall, the fact that we have a pandemic or other kind of more general adversity. And again, this might be one that you experience individually, but if you're working with another person in your family, then you might do it with them too. So some examples are given here of what you might choose for as an adversity. So you might be, for example, concerned about the health of your child with congenital heart disease, or how your other children are doing who are also isolated, how your kids are doing at home, and perhaps it might be challenging for you to be there because you are needing to work outside the home or care for others outside the home. Worried about how you're doing caring for your family, if you're fulfilling the kind of standard that you hope for to meet for your family as a partner, as a parent, caregiver, and having limited access potentially to healthcare for your child with congenital heart disease or any other child with special healthcare needs. So to try to help really illuminate how to use these tools, I'm going to walk through an example that is a personal example of mine. So we're going to start here. You can see I filled in the top of this tool with my own personal adversity, where I have a father who's older, 73, and he has a couple of underlying health conditions and lives in a nursing home setting as well. So the next step is to think about our thoughts. So what are the beliefs that we're having about the adversity that you chose to focus on? What are you saying to yourself in private about this adversity? So some examples might be, I have a child with illness or injury. In this case, perhaps many of you have a child with congenital heart disease, and that child might get COVID. Perhaps you're worried about or having thoughts about being able to afford healthcare or being able to be a good partner, or feeling like the situation won't end. So for me, in thinking about this adversity around my father, the beliefs that I'm having are somewhat similar to the examples I gave, in that I'm having a lot of thoughts about I can't protect him, that he is at high risk, and that he might die. So pretty serious thoughts that can be scary, which leads us to our next part of this tool, the consequences. So what kinds of outcomes and consequences are we having related to the adversity that you chose, and then the beliefs and the thoughts that you're having about that adversity? So first, we'll talk about feelings. So how are you feeling as a result of this adversity and the beliefs? Perhaps you're feeling a number of different feelings: angry, sad, worried. And then think about, what are you doing when you feel that way? So are you showing or hiding your feelings? Are you making healthy choices? And then we're going to think about how all of this is impacting your relationships or other people in your life. So how is this adversity, the thoughts you're having about it, the feelings you're experiencing, the actions you're taking, how are all of those impacting your children, a partner or spouse you might have, friends, coworkers? So in my example about my father, I have been feeling very scared and worried about him and his health, and sad about all of this that we're going through collectively. In terms of actions, then, this is kind of leading me to contact my parents more often, call them, Zoom. I'm also trying very hard to follow all of the social distancing rules that we're learning about, and to be really careful about that, and also to highly encourage and remind others in my life to do the same. And I'm finding that I tend to kind of move or think or perform things more slowly than normal. And this all is having some impact on my relationships with the other people in my life. So it's leading to some conflicts or really just disagreement at times with family and friends about using social distancing appropriately. And that can in turn lead to feeling a little more distant from that support network for me, since we're having some of those disagreements. So other things to think about, especially if you are completing this alone right now, or thinking about this alone right now and not with other family members, how might the ABCs that you just went through and thought about be different for each person in your life? So people in your family, people in your support network, how might they have responded differently to all of those questions and prompts we went through about adversities, beliefs, and consequences? In addition, are other people aware of how you responded? Would they have been able to guess what adversity you're experiencing that would stand out, or beliefs you're having about it and consequences you're experiencing? And have you talked to anyone about all of those things? So let's take what we just did and move to the second tool called the steps to reframing. So during the ABC model, you thought about a specific adversity and kind of gained a greater perspective, understanding about your own kind of response to that adversity. And we're going to now think about how to shift the consequences you just described or thought about to a more positive place. So these are the 4 steps we're going to walk through. And again, we're going to go through them one by one, and you might join me by writing down your answers. So the first step is to accept the uncontrollable. This can be really hard. It's very easy to say, much harder to do at times. And so the challenge here is to think about that adversity you chose and try to identify the things that are truly beyond your control, and to think about then what it would be like to give up that control. So in the first step, for me, in my example, the things that are out of my control are if my father gets COVID or not, and if other people follow social distancing rules or not, are sadly for me outside of my control. And what has also felt pretty outside of my control is being able to operate at full capacity, just day to day. So while it's really difficult to accept that those things are not in my control, what I want to do is shift my focus here to think about what is in my control. So what aspects of this adversity around my father, or for you around the adversity that you chose, what can I focus on that will help improve the situation, that will help cope better, that will help you feel more in control, and help the people around you in your life as well. So again, you might write down for you what those things are for you that are controllable. For me, my own behavior is controllable. So my own social distancing behavior, my own use of coping strategies that I know have helped me, and being helpful to other people. Those are things that I am fully in control of. So the next step, acknowledge your own strengths. So Erica touched on this earlier in one of her tips as well. And I think this particular step, I mean, all of them are helpful to do as a family, but this one in particular, I would say, because it's nice to be able to talk to other people about the strengths you see in them and to hear others describe the strengths they see in you. And so ideally here, you're thinking about what strengths have helped you cope with a challenging situation in the past, which all of us have experienced. And what strengths do you have in your family or your support network that maybe you don't have alone? What strengths do others bring to you? And what among all of those strengths collectively can be applied to the situation at hand, so the adversity that you chose to focus on? So for me, the strengths that I had to think of myself are that I think I'm pretty good at communicating my thoughts and feelings, and finding ways to be supportive to my family and friends. And that those both seem like they would be helpful in this situation of high stress and worry about my father. Now, finally, the last step is trying to now help us shift those consequences that we talked about in the ABC model to a more positive place. So if you accept the uncontrollable and focus on the things you can control and use your strengths that you have identified, how might the consequences you thought of earlier be somewhat shifted or moved? How might this approach help you think differently? How might you see that adversity differently? And how would all of that, if you could do that, impact other people in your life? And is there a kind of a positive take-home message for you? So for me, if I am able to kind of accept all the things I list here as not in my control, focus on the things that I am in control in terms of my own behavior, and acknowledge some of those strengths that I have, perhaps I might find that the worries I'm having become more manageable, that I might have kind of more connectedness with the other folks in my life who can be my support network. So this clearly doesn't change the risk that my father is at, but hopefully helps me move to a more positive place in terms of my emotional coping with the stress I'm experiencing. So the third and final tool that we'll talk about today helps us take more of kind of a future, broader orientation. So this is what we're calling our COVID-19 roadmap. And you're going to see this roadmap on the next few slides as well. And I'll walk you through how we're going to use this roadmap. So dealing with this pandemic can be thought of, and really any kind of stressful experience can be thought of as a journey where there's kind of a beginning, a middle, and an end. And along that path, we'll experience particularly challenging moments or situations. And sometimes when we have those moments, we can get stuck there and kind of focused on just the stressful experience we're having at the time. And it can be harder to see a broader picture of life and that this is a moment along a bigger path. So we're going to use this roadmap to try to help us think more broadly about the past, present, and future of this pandemic that we're experiencing. So for the first part of this roadmap exercise, let's try to think, and you can write this down, where do you see yourself on this map now, and why? And then where were you on the map in the first or earlier portion of this kind of COVID-19 pandemic and journey? And then think about how is your position on the map at each of these time points? How did that impact your family, your daily life, the relationships that you have? So to carry my example through, I think for me, at the time that I did this, I found myself currently in that roundabout there, going in circles, just trying desperately to get everyone in my life to follow all of the social distancing rules that were in place at the time very carefully. That this was my way of ensuring that everyone's doing their part to keep everyone safe, including my father. And that felt stressful, just kind of on a continuous kind of circle here. And that was a different place than where I was when this whole journey of the pandemic started, where I was likely just before that roundabout and kind of slowly starting to understand what is happening here in this world with this pandemic coming about, and not yet sure of the severity of the situation in general and in the US in particular. So then we want to think about a time in the future. And this will be individual, so you might choose to think about 2 weeks from now. That's as far out as you want to go. You might try to think about 2 months, 2 years from now, whatever feels comfortable to you, just any time in the future. And to try to think about at that time in the future, where would you be on the map then? And what is happening for your family at that point? What is daily life like? And how could you move by that point in time to a more positive place? So for me, I decided to think about 2 months in the future. That felt comfortable to me, or most comfortable. And at that point in time, I thought, okay, I might be at that lookout point. And reflecting back on what we've been through, and seeing potentially a more stable or predictable future. And in that sense, I might have kind of a decrease in the amount of anxiety I'm experiencing or worry, because I kind of know what to expect a little bit more and have found kind of a new normal in some ways, with new routines. So to kind of drive home again this kind of importance of how to use these tools with your family, really with the goal of reinforcing overall family resilience. We're going to talk a little bit about that to finish here. So some of the benefits of doing this as a family is to gain different frames of reference. So by sharing with others in your family what your ABCs are, your adversity that you would identify, the beliefs you're having, the consequences, you get to understand how your experiences are matching up or not with the other people in your family. And you get to kind of get a better range or appreciate a range of consequences that come from these different viewpoints. And then be able to think about how having different viewpoints that interact with each other kind of work and don't work sometimes. And it allows more opportunity for people to help each other if you understand more about how everyone's feeling and acting. And by doing the kind of steps to reframing together, as I mentioned earlier, we can really help kind of focus on strengths and think about the way that collectively working together can benefit everyone and lead to a more positive place. So again, here, the goal is to understand different perspectives. It is not, there's no kind of right or wrong answer. It's about acceptance and understanding, and to identify kind of the benefits and challenges of having different perspectives and experiencing and dealing with things differently. We note here too that it can be helpful to engage your children in this exercise. Depending on their age, that would look differently, but we have heard from folks that bringing this to adolescents, for example, and depending, perhaps maybe kids in pre-adolescence as well, can be useful. So moving forward, again, these are tools. So our hope is that maybe you jotted some notes down today about this, all of these tools, and you have a place to put up things that you wrote down to help you remember to use them and what they are. And perhaps there was one or two tools that really kind of resonated with you more, and that those might be the most helpful to kind of keep handy. And you might also consider pulling these tools out, particularly when you're experiencing stress or traumatic stress, or maybe you have a regular kind of family check-in, or other kind of regular interval with your support group. And to really think about in those moments when you're stuck and having a lot of stress, that these might be helpful. So another just kind of reminder about these tools being a process, so that they really require you to actively engage them and use them for them to be helpful. So I want to end by showing this, our website here, healthcaretoolbox.org. We have a number of resources for families. I'm going to show you another slide that shows some of those. The slides that I just went through today, we're going to be posting a larger, kind of more comprehensive version of those slides in the coming weeks. They are free on our website. You can download them and share them with whoever you think might find them useful. So please do check back on our website to see if they're up there yet. These resources are already on our website, healthcaretoolbox.org. We have general kind of child and caregiver handouts about traumatic stress and coping with traumatic stress that are in Spanish and in English. We also have a parent tip sheet specifically related to COVID-19 and are generally geared towards families that have a child with special healthcare needs. So they are not CHD specific, but they do kind of speak to that general population. So you can find those there also in English and in Spanish. So I'm going to leave my slides on this so you can see our website here, but that ends it for me, and I hope that we can answer some questions and have some discussion with all of you. Thank you.
Thank you both so much. That was very informative. And we've had several requests for us to send them the website. So if, Julia, if you will send me a link, I will share that with them, all the websites. I will share it with everyone attending and everyone. There were several people who could not be on at this time today, and they would like their recording. So I will provide that with the websites as well. So we're going to open it up right now for questions. And I think Dr. Sood and Price, I did make your video. I finally figured out how to make you able to show your videos. If you want to answer the questions with your video on, if people have them, can you please type them in the Q&A box there? I would like to start with a question like, do you, so I have a 16-year-old going on 17, and I know you, these resources in this toolkit are excellent, but do you have thoughts about some different things for the older child that you have found really helpful for them?
Julia, do you want to answer that, or do you want me to?
Sure. I mean, I can give a quick one. So, you know, I think if you're thinking about adolescents, young adults, I think that the tools that I just went through are certainly, would certainly be applicable to that population as well. And they could certainly use them alone or with a parent or caregiver. And even with another kind of person in their life that they trust. So we don't have a specific toolkit that was designed with examples in it for young adults or adolescents yet. We may try to do that, but I think these tools could still be useful for them.
Yeah, it's been an interesting age because I think my son is like, he's so much less likely to talk to me, you know, than he used to be.
Yeah, it's hard. I think, you know, I think even sharing and encouraging to go through alone, but it can even be helpful even if they're not willing to share a lot. If you are willing as a parent or caregiver to walk through an example of your own, if they're willing to sit down with you at least and look at the tools, and you can show them one that really stood out to you that has helped you, it might model something that they might find something within that they can latch onto and kind of use on their own then.
Okay. And
I think with regards to COVID-19 more generally, there are a number of books that have been developed, like almost like booklets that you can just download for free online that are for kids. There have been some developed, now not kids, not teenagers or young adults necessarily, but younger kids. And I think that there's actually some also for one for kids with disabilities. If you go to the CNOC website, again, it's cardiacneuro.org, and go to the COVID-19 tab. On the handout for Parents Helping Children, there are a number of books listed there. And I think that probably since we developed that, there are probably more out there. So it may also just be worth doing a Google search for resources for children and COVID-19. I think there's a number that will come up.
Okay, and another question came in before the webinar, and it was about assimilating back in with extended family. And I can say, like, everyone has their own ideas about what people should be doing and shouldn't be doing. And sometimes like grandparents or aunts and uncles, you know, if they live in the area and or you want to visit them, like it's summer vacation for people. Can you talk a little bit about dealing with that issue in terms of the mental health and stress aspect of it? I know it makes me really tense when I talk to family members sometimes because I have a different view on things than they do.
I think it's really, I mean, I have found this. I think everybody is interpreting the risks, the information in different ways. And so I think with any, you know, every state did a different phase right now of reopening. And everybody's going to have a different interpretation of kind of what they feel what risk they feel willing to take, what seems reasonable, what doesn't seem safe. And so it is really hard because it's very likely that people are going to be coming at this from different angles. And I think from a mental health perspective, really thinking about, you know, what are you comfortable with as, you know, as a family, as a parent, making sure that it's something that, you know, if you have a partner or spouse, that you can kind of come to a consistent place of where you're following the guidelines in your area, but then also doing things that make you feel comfortable and feel like you're protecting your family. And that's probably going to look different than your neighbor or your friend. And then really figuring out, I mean, if it's not seeing extended family right now, how do you help parent kids to feel connected using technology, using, you know, mailing letters, mailing care packages, finding other ways to stay connected.
Right. I think, Liz, you had a question?
Yes, I do. So my son is same age as Jody's son. Well, he just turned 17. And one of the things that I found really challenging during this period with COVID was the lack of information about being high risk and what that meant. I mean, heart disease was very quickly and listed as high risk, but because, and understandably, there wasn't data about it or enough data that they could parse down that far to be able to say, is CHD an issue, or is it acquired, or if it is CHD, what type of CHD? And so that was a really hard place for us to navigate, because we had to make the assumption that he was very high risk, but without being at that age, not being able to say much other than, well, the data's not in, but we have to assume. And I don't know if you have any guidance on how to have that conversation such that there's less anxiety or lack of clarity. I mean, I think the lack of clarity creates an anxiety because we're having to say science doesn't know. Well, I think, I mean, so I don't know if you have any comments on that or not.
Yeah, we don't know. You know, and I think, you know, data is slowly coming around in some areas more than others, and I don't know that there's been a ton of focus on pediatrics, and you know, I'll leave that to other people to describe the results of that. I think that the part that you're asking about too is the anxiety that's born out of all of this uncertainty, and I think, you know, as much as is possible, I think I'm hearing a lot of themes around communication with other people in your family about what guidelines or how there are and how you're going to follow them, communication about the stress you might be experiencing or adversities you might be experiencing with teenage kids, and maybe with partners. And I think as much as, you know, we can in this very stressful, uncertain time to encourage more open conversation maybe than we would normally have about how we're doing emotionally with other people who we trust in our lives can be really helpful to try to manage this uncertainty. Yeah, Erica, I don't know if you have more.
Yeah, no, I'm not just going to say it's a particularly hard time for parents of children with special healthcare needs, because you are having to make these very difficult decisions without data, without any information. And the truth is, you know, your child's doctors probably don't know a whole lot more than you do, because this is all new to everybody. And so I think in those situations, you know, you just have to use your judgment as a parent and just determine what you feel comfortable with and what your family is going to do. And it may be different than what other families are going to do. And also to just acknowledge that it's okay I mean, teenagers are going to be mad, and that's okay. And they're going to feel frustrated, and they may be angry because you're telling them that they can't do certain things that they want to be able to do. And that's teenagers anyway, but especially during these situations. And so, you know, again, just acknowledging that it's okay to be angry, but that this is a decision that you're making as a parent with the information that you have, which is probably not much, but what's available to keep your child safe. And that is the biggest priority. And so, you know, it's okay to feel angry, it's okay to feel frustrated, and we're going to make the best that we can in the situation. But I think just acknowledging that, yeah, of course your child's going to feel angry, especially if it's not how his, you know, best friend's parent is responding, but you just got to do what feels right to you.
Thank you. Lauren would like us to say the name of the resource with the books and resources out loud, and that's healthcaretoolbox.org, Lauren. So if you go to healthcaretoolbox.org, you should be able to find that under tools and resources. And we've had several questions. I had someone emailing me a question, and then we also have a question on chat. from Danielle about back to school. We have a lot of really stressful feelings and concerns about back to school, and what if our kids can't go back to school? What if they're too high risk? What if there's no school? What if it's online school? How do we manage all of this in our families?
Yeah, and I think what's hard too is that many kids with CHD do have special, have developmental needs and academic needs that are really hard to meet through remote learning. And so it's challenging both ways, right? You want to keep them safe medically, of course, and with regards to health. But then also you want to make sure that they're getting their developmental and academic needs met so that they're not falling behind, especially if they're a child who has, any special education needs. I think in terms of, and schools are looking at a variety of different options for reopening. And I don't think anybody can say right now what that's going to look like for next year, but it does seem like districts are exploring many different options of what that could look like, whether it's, going back with smaller classes, whether it's alternate days, whether it's a combination of in-person versus remote. The hope, of course, is that by that point, there will be more information about the risk of kids specifically with congenital disease. I think that my understanding is the risk has been less than was feared. But I'm not a medical doctor, and I defer to your cardiologist on that. So talk to your cardiologist, find out what their opinion is. And then I also think, everybody is coming from different regions and different states. And so it's also important to look at, if you're in a state where cases are increasing exponentially, that you may be making a different decision than if you're in a state where there is a relatively low number of cases. But I also have heard that COVID's not going away anytime soon. And that, we all need to learn how to adapt, and keeping kids out of school indefinitely is probably not the answer. So I don't think anyone would be able to give a solid answer to that, but I think talk to your cardiologist. Hopefully there'll be more data by that point. And I think that there's a lot of effort from school districts going into how to make next year work in whatever format that looks like, and being more prepared than I think districts were when they all of a sudden had to go out and scramble to figure out plans.
Yeah, okay. Well, I know that it's a common question, and we keep hearing it, and people are very stressed about it. And the question with school also involves siblings, like if the siblings ask not to go back to school too, and the resentment that can occur, and how do you deal with that with a sibling who you may not be able to do as much as a family, and how do you work with that as a parent, that resentment or any feelings that come up with that, I guess?
Yeah, I think, again, there's a theme here developing about acknowledging and tolerating uncertainty and communication about all of it in families. And I think this relates to the school question too, that showing all the children in the family how carefully you're considering these complex decisions right now, and all of the ways in which you're trying to think about what's important. So that includes clearly safety for everyone, including safety for kids who are more at risk, like kids with congenital heart disease, but also includes mental health safety around finding ways that are safe and creative to have social time and things that will support kind of relaxation and important happy family times and times with school and friends in some ways that are possible. So I think unfortunately there's no kind of one right answer to how to cope with or manage this for all families. I think more thinking about what's the process that your family can use to kind of digest this stressful time and the losses that you as a family might be experiencing around not being able to see friends or do things you'd like to do or go to school, or and communicate about them, acknowledge them, and think creatively together about what's okay from the caregiver perspective to do safety wise, and then get some help from kids to think about creative ways that would feel feel like they're getting to do something that would help them feel better.
I encourage you to communicate with school staff about this, because, you know, especially if your child does have any developmental needs, it's really important, or has an IEP or a 504 plan, it's really important to be in touch with the school and figure out, you know, what would that look like next year? You know, whether it's fully in person, you know, that's probably easier because it's going to look a little bit more like it did before. Whether it's half remote, half in person, whether it's fully remote, you know, whatever happens, having some conversations with the special education staff around, you know, what are the plans? Again, you know, the school district had very little time to prepare this year. It was sort of all of a sudden everyone went out and nobody went back. And I think that, you know, this is a time where there's a lot more thought being put into how to really make this work next year for teachers, for families, for kids.
Well, excellent. And we're a tiny bit over time, but those were such good answers. And I really appreciate you guys taking the time to do this. This was an excellent webinar with a lot of great information. And I have had a lot of people emailing and texting saying, hey, we weren't able to get on, but we really do want the recording. So we will provide that. And we'll provide that list of resources as well. Thank you so much, Dr. Sood and Dr. Price. This was really nice. And we appreciate all your help and support and everything you do to help families like ours.
Yes.
Thank you for inviting us to talk about this.
Yeah, thanks so much.
Okay, bye.
Bye-bye.